Hello there, guys, and welcome to the first of our educational videos on anatomy, where we're going to be breaking down the main muscle groups that we target inside the gym sessions, so you can start getting a deeper understanding of why these muscles are so important to train and get them nice and strong for your longevity and life quality. The first one of the muscle groups that we're going to be breaking down is one called the hip flexors. The hip flexors help us to flex at the hip, aka bend at the hip or lift the knee up. And there's two main muscles that we look at when we look at the hip flexor group. The first one is the rectus femoris, which goes from the hip down towards the knee. And the next one is one called the psoas, which goes from the hip into the lower vertebrae in the spine. Now, you'll know if you've already attended some of our sessions, but tightness itself is usually a symptom of weakness. When a muscle is no longer strong enough anymore to be able to support the skeleton properly, our body tightens up to create an artificial form of stability that we're no longer providing it. However, this tightness, of course, tends to lead to postural dysfunctions. And here's what that looks like with hip flexors. If the rectus femoris gets a little bit too tight, then what it starts to do is it pulls the front part of the pelvis down, which makes the back part of the pelvis rise up. This causes the lower back to compress and can give you a kind of constant backache. But the other thing is, because the pelvis is now lifting up at the back, it also causes the hamstrings to tighten up as well, because they're always in a kind of permanently lengthened state. And no matter how much you stretch the hamstrings, you would never ever get permanent relief unless you start fixing these problems at the front end. So that pelvis rests itself, and then the hamstrings return to a normal length. When we look at the psoas, that's a little bit worse if things get tight, particularly if we have the tightness just exacerbated on one side. If we start getting a lot of tightness on one side, it can start causing the hips to twist and rotate, meaning the spine no longer sits properly anymore, right? This can end up giving us symptoms like a curvature of the spine, but it can also mean that the spine is just no longer able to take loads properly. So you might just be lifting a relatively light weight one day, or you might bend down to tie your shoes, something like that, and you might end up getting a slip disc just as a side effect of these muscle groups here being far too weak and far too tight on one side. Now, when we're looking towards life quality and performance, the hip flexors, as we said, they help to bend the hip or lift the knee. So every single time we're doing anything where we lift that knee, the hip flexors get involved, aka every single time we're walking, every single step that we take, we're going to be lifting that knee up, which of course means that if we go for a run, every single stride that we take forward, we lift one of those knees up. If you do any kicking-based sports, so like if you do football or if you do Muay Thai or something like that, every single time that you're driving that leg forward, it is the hip flexors that are producing that power. So if these muscle groups start getting weaker over time, it starts meaning that just everyday tasks like walking starts feeling heavier, going for a run starts to feel like your legs are made of lead, going up the stairs is going to feel like a chore as well. And of course, any kind of kicking motion that you do, if these muscles here are getting relatively weak, and especially if they're plenty tight on one side so that skeleton's not quite sitting right, no matter how much intent you've got behind it, you're just going to start feeling like you have a lack of coordination whenever you're trying to kick any kind of target. So how do we start treating these problems? Well, if the hip flexors flex the hip, then if we want to stretch them, what we need to do is open the hip. And we normally do that whenever we're doing any kind of kneel and stretch. So when we're doing things like torso rotations at the start of sessions, we are pushing that hip forward and we are opening the hip flexors here, which is why you start feeling that stretch kind of happening at the top of the quads there, and why you start feeling it just a little bit above the hips there. So once we spend a little bit of time opening up the hip flexors, the next thing we do is strengthen them. And as you say, the main job of the hip flexors is to lift the knee up. And that's why things like the banded march is a perfect exercise for us to do, where literally all we're doing is lifting the knee up with plenty of load. When we start doing the right treatments for the hip flexor groups, they tend to respond pretty fast on people, because usually they're a muscle group that gets neglected so much that they're quite sensitive towards adaptations for any kind of stress that we put on them. So even if you've got super tight hip flexors, normally within about 4 weeks of regular training, people can see drastic improvements inside this muscle group. And I would say if you have about 3 months plus worth of training inside there, you can strengthen your hip flexors enough to start feeling like you've got those youthful level of athleticism again. Because obviously if your hip flexors are super strong, things like running is going to start feeling more explosive. Any kind of kicking motion is going to start feeling a lot more explosive. Just going up the stairs is going to feel a lot easier, and that's going to make life feel a lot better. Hopefully now you've got a better understanding of the hip flexors, all the kind of problems they can cause, from lower back pain to knee pain to tight hamstrings, and you also understand right now why, if we train these muscle groups, why they're so important for being able to give us a sense of youth and athleticism again. Enjoy, stay tuned for the next video. Take care, guys.